If you're over 60, there's one small daily habit that could quietly raise your risk of stroke, especially in the early morning hours while you sleep. No discomfort. No obvious signs. 1 minute you're feeling fine, and the next you may find it difficult to move your arm, speak clearly, or stay balanced. As someone who spent years treating brain health in older adults, I've seen this happen far too often. And it wasn't caused by smoking, poor eating habits, or lack of exercise. It was something much more unexpected: vitamins. Yes, the very supplements many seniors take each morning, hoping to strengthen their bones, sharpen their memory, or boost energy. While some of these supplements are helpful, others, particularly when taken in excess or at the wrong time, can quietly place extra strain on your brain and blood vessels. Certain vitamins can increase your blood pressure, disrupt circulation, or interfere with your natural healing rhythms, especially during the night when your body should be resting and repairing. That's why today, I want to gently walk you through 5 common vitamins that may be doing more harm than good. Vitamins like D, E, B6, A, and niacin are often taken without a second thought. But the truth is, each one carries a potential risk when misused, and for seniors, especially those with existing conditions or on medications, understanding these risks could make all the difference. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Vitamin D. It has a good reputation. You've probably heard that it's essential for strong bones, a stable mood, and a healthy immune system, and that's true, in small, carefully measured amounts. But what often gets left out of the conversation is what can happen when that balance is ignored, especially for older adults. The timing and dosage of vitamin D can make a world of difference. And if taken the wrong way, it may quietly raise your risk of stroke while you sleep. I want to share a story that still stays with me. A patient of mine, Mr. Harold Simmons, was a 76-year-old retired accountant from Minnesota. He was meticulous in everything he did: his paperwork, his diet, even the way he took his supplements. Every night, just before bed, he'd sit at his kitchen table with a tall glass of water and line up his pills. Among them was a 10,000 IU vitamin D capsule, one he picked up from a local pharmacy on the advice of a friend. He believed he was doing something smart for his bones, especially during those long, dark winters. What he didn't know was that this simple habit was setting off a chain reaction deep inside his body. One morning, his daughter called 911 after she found him disoriented and unable to lift his right hand. At the hospital, we discovered he'd suffered a stroke during the night. His labs painted a troubling picture. His calcium levels were dangerously high. His arteries were rigid, and his blood pressure had spiked. After digging into his medical history and lifestyle, it became clear what was going on. It wasn't a freak event. It was vitamin D toxicity. Most people don't realize this, but vitamin D, in high doses, increases calcium absorption in the bloodstream. And without proper balance, without enough magnesium, without medical oversight, that calcium can't be properly distributed. Instead of going into the bones where it belongs, it builds up in soft tissues, including the arteries. That buildup causes the blood vessels to stiffen, narrowing the pathways where blood needs to flow freely. Add in a dehydrated body, an aging cardiovascular system, and a high dose taken right before sleep, and you've created conditions that are ripe for a stroke. No pain, no warning. Just a sudden, irreversible event. The most troubling part is how common this has become. Many over-the-counter vitamin D supplements in the United States contain far more than most older adults actually need. It's not unusual to see 5,000 IU or 10,000 IU on a label. People take these daily without ever checking their vitamin D levels, assuming that more means better protection. But studies have shown that even 2,000 IU a day may be too much for seniors who are not deficient. The body's ability to process and regulate these levels changes with age. What once was harmless can quietly turn harmful. And the timing matters. Taking vitamin D late in the day, especially in the evening, can increase the risk. Why? Because vitamin D affects calcium metabolism, which in turn influences how your heart and blood vessels behave overnight. During sleep, your blood pressure naturally dips to allow your cardiovascular system to rest and repair. But if you've taken a high dose of vitamin D before bed, it may interfere with that natural rhythm. Your blood vessels may not relax the way they're supposed to. Instead, they stay tight. Calcium builds up. Pressure rises. And if you're already dealing with heart disease, blood thinners, or circulation issues, that imbalance could tip the scales. That's why it's so important, if you're taking vitamin D, to have your blood levels tested regularly. Don't guess. Know. And if your doctor hasn't advised a high dose, reconsider whether you need it at all. The better approach is to take it in the morning with food, in a lower dose, and only when your body actually requires it. For most older adults, a modest amount, often less than 1,000 IU per day, is more than enough when paired with time outdoors and a healthy diet. Looking back at Mr. Simmons, his stroke didn't come from recklessness. It came from doing what he thought was right, without realizing the risks. And that's what makes this so important. Many of us take vitamins with the best intentions, but at this stage of life, our systems work differently. We need less of some things and more awareness about how even a helpful nutrient can become dangerous when taken in the wrong way. So before you reach for that vitamin D bottle tonight, take a moment, look at the label, check the dose, and ask yourself whether it's doing your body good or asking too much of it when it's most vulnerable. Now, if vitamin D can stiffen your arteries and quietly raise stroke risk, imagine what can happen when another vitamin thins your blood too much. The next supplement we're going to talk about is often taken for heart health, skin, or anti-aging, but for older adults, it can lead to something even more dangerous than a clot, a brain bleed. Let's take a closer look at vitamin E. 2. Vitamin E. Vitamin E is often called the heart helper, and for good reason. It's been promoted for years as something that can support healthy circulation, protect blood vessels, maybe even sharpen the mind or keep the skin youthful. If you've been taking it as part of your daily routine, especially after turning 60, You're not alone. It's one of the most common supplements among older adults, especially those hoping to take charge of their heart health. But there's a side to vitamin E that rarely gets mentioned, and it can have serious consequences, especially for those already managing cardiovascular conditions. I'll never forget a woman I once treated, Miss Lorraine Myers, Boscher R., a retired piano teacher from Northern Illinois. She lived independently, cooked for herself, and could still play Chopin by memory. Lorraine was the kind of person who read every health article she could find and prided herself on staying proactive. Years ago, she'd been diagnosed with a minor heart valve issue and had been on a low dose of warfarin ever since. Her labs were always steady, her blood pressure was well managed, and her care team kept a close eye on her progress. But one day, after reading about the memory and circulation benefits of vitamin E in a senior living magazine, she picked up a bottle at her local store. It was labeled natural, which gave her confidence. And each capsule contained 800 IU. She thought she was doing something kind for her body. No one had told her there could be risks. Just 3 weeks after adding it to her routine, she developed a terrible headache, followed by nausea and sudden confusion. Her neighbor called for help. At the hospital, a CT scan revealed bleeding inside her brain, a hemorrhagic stroke. It wasn't caused by a fall. It wasn't due to a spike in pressure. The cause was far more silent. Her blood had become too thin to clot properly. The combination of warfarin and the high-dose vitamin E had made it almost impossible for her body to stop even a small bleed. One fragile vessel in her brain had burst, and within seconds, everything changed. What most people don't realize is that in high doses, vitamin E acts like a natural blood thinner. It slows down clotting, and if you're already taking medications like aspirin, clopidogrel, or prescription anticoagulants, adding vitamin E on top can quietly push your clotting ability into a danger zone. The brain, in particular, is vulnerable. Even a small bleed can affect speech, memory, or motor skills. Lorraine survived, but she never returned fully to the life she had before. She now uses a cane and tires more easily. Her ability to recall names and events faded, and she stopped playing piano altogether. In her own words, "I thought I was helping myself. I didn't know it could turn on me." And she's not the only one. Far from it. So many older adults assume that if a supplement is on the shelf, it must be safe. But that's not always the case, especially when it comes to high-dose vitamins. The recommended daily intake of vitamin E for seniors is about 15 milligrams, or roughly 22 IU. That's all the body needs in most cases. But walk down any supplement aisle, and you'll see bottles advertising 200. Sube, aven vienas tūkstantis IU per capsule. No warnings, no guidance, and no mention of the potential interaction with blood thinners or heart medications. Vitamin E is fat-soluble, which means it stays in the body longer than water-soluble vitamins. That makes it easier to build up over time, especially when taken daily in large amounts. What starts as a well-meaning effort to protect the heart can, over time, lead to dangerous bleeding, sometimes in the brain, sometimes internally, often with no symptoms until it's too late. If you're managing any kind of heart condition or taking medications that affect your blood, it is absolutely essential to speak with your healthcare provider before adding vitamin E or increasing your dosage. It's not about fear, it's about being informed and protected. Supplements can help, but only when they're used wisely and in context with your full health picture. And while vitamin E can thin the blood too much, the next vitamin carries a different kind of risk. One that targets your nerves, your balance, and sometimes even your independence. It's another nutrient often taken for energy and brain support, especially as we age, but in the wrong amounts, it can slowly damage the very nerves that help you walk, move, and feel the ground beneath your feet. Let's take a closer look at vitamin B6. 3. Vitamin B6. Vitamin B6 is often marketed as a natural nerve protector, a brain booster, or an energy aid. You've likely seen it on the shelves at your local pharmacy, in blends that promise to support memory, improve focus, or keep the nervous system sharp as we age. And for many older adults, it feels like a wise, proactive choice. But here's what doesn't get said loud enough, especially to those over 60. In high amounts, vitamin B6 can do the exact opposite of what it's intended to do. It can quietly damage your nerves, and sometimes the effects are permanent. Let me share a story that stays with me. A patient of mine, Mr. Clyde Barrett, was 77 years old. A former school bus driver from rural Nebraska, Clyde had always been active. He gardened, walked his dog every morning, and still tinkered with old engines in his shed. But over time, things started to feel off. He began noticing a strange tingling in his hands and feet. Then numbness. He brushed it off at first. I thought maybe it was arthritis or just part of getting older. But then came the stumbles, the dizziness. He started falling. Once in the kitchen, another time out on his porch steps. The third fall left him with a fractured wrist and a growing fear of being alone. When he came to see me, we went through everything: his diet, his activity level, his medications. But what caught my eye was a supplement he had been faithfully taking every day for over a year. It was one of those over-the-counter nerve support formulas. The label promised to support memory and improve circulation, but each tablet contained 100 milligrams of vitamin B6, and he had been taking 2 per day. That's 200 milligrams, 10 times more than the safe upper limit for seniors. And unlike water-soluble vitamins that flush easily from the body, especially in older adults, the way it harms the body isn't always obvious at first. But inside, something very real is happening. That excess B6 starts to damage the protective sheath around your nerves, the very insulation that helps your brain talk to your muscles. Your fingers, your legs. Over time, it becomes harder to walk, harder to grip, harder to feel. For Clyde, by the time we caught it, the damage had already taken hold. We stopped the supplement, and thankfully it didn't get worse. But he never fully recovered his balance. He walks with a cane now and gave up driving for good. I remember him saying, "Doc, I just wanted to keep my mind strong. I didn't think I was hurting myself." And that's what makes this so painful. He wasn't careless. He was trying to do the right thing. Vitamin B6 is important, but only in small, careful amounts. For older adults, the daily need is somewhere between 2 and 10 milligrams. And that includes the amount you get from food, things like chicken, potatoes, bananas, and fortified cereals. But many brain or energy supplements you see online or at the drugstore contain 50 eBay, sometimes even 200 milligrams per pill. Those numbers aren't just excessive, they're dangerous. And here's the real problem. This kind of nerve damage from B6 builds slowly. Most people don't feel anything at first. When the tingling begins, they think it's joint pain or circulation. When balance becomes shaky, they blame aging. By the time it's clear something's wrong, it's often too late to undo it. And unlike some other side effects, the nerve damage caused by excess B6 doesn't always go away. For some, it becomes a new part of daily life, one that could have been avoided with a simple check of the label. So if you're taking anything that says nerve support, memory boost, or energy formula, take a close look. Know how much B6 is in each dose. And if you're not sure what the safe range is for your body, talk to someone who knows your health history. It's not about fear, it's about clarity and protecting the body you've worked so hard to care for. Now, some folks figure that at least other vitamins must be safer, like vitamin A. After all, it's known for helping eyesight, and it's been around forever. But the truth is, even vitamin A can become a quiet threat when taken without caution. Let's talk about what happens when the dosage of that one gets too high. 4. Vitamino. Let's take a moment to talk about vitamin A. For most older adults, it's one of those nutrients that sounds reassuring. You've probably been told at some point that it's good for your eyes. Maybe you've taken it for your immune system, your skin, or because someone mentioned it supports graceful aging. And in small, well-regulated amounts, that's all true. But what rarely gets mentioned, especially to people over 60, is that too much vitamin A doesn't simply pass through your system. It stores up quietly and can cause more harm than good if you're not careful. I once worked with a woman named Mrs. Irene Wallace, 78 years old, a retired librarian from New Mexico. Irene was sharp as a tack, loved reading mystery novels, and had a quiet pride in living independently. She had a bookshelf in nearly every room of her home, and she still taught beginner Spanish classes at the community center. But several months ago, Irene started experiencing a deep pressure in her head. At first, it was just a nagging headache. Then her vision became blurry. She felt lightheaded and nauseous. Her speech started slurring. Her family thought she was having a stroke and rushed her to the hospital. But her brain scans told a different story. There was no clot, no bleeding. What we saw instead was increased pressure inside her skull, something that looked and felt like a brain tumor, but wasn't. The diagnosis, pseudotumor cerebri. A buildup of spinal fluid was placing stress on the veins in her brain, mimicking a stroke. And the surprising cause was something she never suspected: vitamin A toxicity. Irene had been taking a skin and vision supplement for years. The label advertised support for eye health, anti-aging benefits, and immune protection. Each capsule had nearly 10,000 IU of vitamin A, and she'd been taking one every day for over 5 years. Without a second thought, she also didn't realize her daily multivitamin contained a full dose of vitamin A as well. It added up slowly, quietly, until her body simply couldn't manage it anymore. Here's the part many folks don't know. Vitamin A is fat-soluble. That means your body doesn't get rid of the extra through urine like it does with vitamin C or the B vitamins. Instead, vitamin A gets stored in your liver, in your fat tissue, and even in your brain. And as we age, the body becomes slower at processing and removing those excess amounts. What once might have been tolerable at 40 becomes dangerous at 70 or 80. Too much vitamin A over time can trigger a host of neurological symptoms, headaches, vision problems, dizziness, nausea, even long-term damage to your eyesight or cognitive function. It's not uncommon for it to present as something more serious, like a stroke or even dementia. And the tricky thing is that it doesn't happen overnight. It creeps in. Many people think they're just having a tough week, or that their glasses need adjusting, when really their body is carrying more vitamin A than it can safely handle. The safe upper limit for older adults is generally around 500 to 3 IU per day. But that's assuming there's a medical reason to supplement. Most people get enough vitamin A through food, things like carrots, spinach, and fortified cereals. What's dangerous is how easy it is to go far beyond that without realizing. Many supplements online or in stores contain 5,000 to 10 nulles IU per capsule. And when those are taken every day for months or even years, the risk grows steadily. Irene is slowly improving. Her headaches have eased. She's doing regular balance exercise now. And she sees an eye specialist to monitor the pressure in her eyes, but she still struggles with reading for long periods. Her vision never fully returned to where it was. She told me, with tears in her eyes, "I thought I was taking care of myself. I didn't know I was causing damage." And that's the heartbreak of it. She wasn't careless. She was trying to stay healthy. But like so many others, she didn't have all the facts. That's why these conversations matter. Not to scare, but to inform. Because what you don't know about a vitamin can hurt you, even when you're trying your best. If you're taking supplements for your eyes, your skin, or aging in general, take a moment to look at the label. Ask your doctor if you really need it. Because sometimes less truly is more, especially when it comes to fat-soluble vitamins that stick around long after the bottle runs out. And just when you think you've heard the worst, there's another vitamin out there, often taken for cholesterol and heart health, that has a very different kind of effect. It doesn't build up slowly. It acts more like a trigger, sudden, forceful, and often without warning. When taken in excess, it can send your blood pressure soaring and leave your body caught in a state of dangerous overstimulation. Let's talk about niacin. 5. Niacin. Let's take a closer look at niacin, also known as vitamin B3. It's a name you've likely heard before, especially if you've ever talked with a doctor about cholesterol or heart health. Niacin is often praised as a natural way to lower LDL and raise HDL. For years, it was commonly prescribed, and to this day, it still shows up in over-the-counter heart supplements, multivitamins, and even energy drinks or fortified breakfast cereals. On the surface, it seems like a good idea, one small pill to support your circulation and protect your heart. But what's often left out, especially in conversations with older adults, is just how risky this vitamin can become when taken in high doses. I remember a patient, Mr. Gerald Lawson, 83 years old, a retired school bus mechanic from Central Georgia. He'd spent his life waking early, working with his hands, and taking care of his family. Even in retirement, he was careful about his health, watched his salt, walked every morning, took his pills on time. But a few months ago, Gerald started feeling off. His face would flush bright red after breakfast. His heart would pound. He felt lightheaded every time he stood up. Some mornings, he could barely get through his crossword without stopping to steady himself. His wife worried it was anxiety. His daughter thought maybe his blood pressure medication needed adjusting, but the real issue was something deeper, something no one had thought to ask about right away. When I reviewed Gerald's list of supplements, one label stood out. A heart formula he'd bought online. Right on the front, it promised to support healthy cholesterol and circulation. Sounded harmless, but when I flipped the bottle over, I saw it 1,000 milligrams of niacin per serving. And Gerald was taking 2 servings a day. That's 2,000 milligrams, over 60 times the typical daily need for someone his age. Now here's what happens when that much niacin enters your system. It starts by relaxing your blood vessels, which is why so many people feel a sudden flush warmth in the face, a tingling sensation. But after that flush fades, those same vessels can snap back into a constricted state. That rapid narrowing raises blood pressure. It places strain on the heart and restricts blood flow to the brain. In younger people, the body might adjust, but in someone over 60, whose vessels are already less flexible, that back and forth can act like a slow, repeated tap on already fragile glass. And in Gerald's case, something eventually cracked. He experienced a transient ischemic attack, a TIA, a warning stroke. His speech slurred for a few minutes, and his arm went weak. Then everything seemed to return to normal. But it wasn't just a fluke. It was the result of months, maybe years of unmonitored high-dose niacin. When I explained this to him, he shook his head. I thought I was helping my heart, he said. Didn't know I was putting my brain at risk. And sadly, Gerald isn't alone. Many older adults take niacin in supplement form without understanding the risks. Some go for flush-free versions, assuming they're gentler. Others pick extended-release pills, thinking they'll avoid side effects. But these forms can still raise blood pressure, trigger irregular heartbeats, and interfere with blood sugar levels. The body doesn't always react immediately. It's the cumulative effect that becomes dangerous over time. For most seniors, anything above 50 milligrams of niacin per day should only be taken with close medical supervision. And if you're already managing high blood pressure, heart rhythm issues, or diabetes, the risks become even more serious. Supplements that seem safe, especially ones marketed as natural or doctor-formulated, often contain more niacin than your body can safely handle. Gerald stopped taking the supplement that day. We adjusted his medications, monitored his blood work, and thankfully, no lasting damage was done. He's back to walking each morning, though more cautiously now. And I'll never forget what he told me at his follow-up appointment. I just wanted to keep my heart strong. I didn't know I was gambling with my brain. And that's why this matters so much. It's not about blaming people for trying to stay healthy. It's about making sure they have the full picture. Because the truth is, niacin, like many other vitamins, has its place, but only when used with care, too much, too often, or without the right oversight. And it stops helping, it starts hurting. Now, if a vitamin marketed for heart health can affect your brain that deeply, it raises an even bigger question: how many of the supplements we take are truly supporting us? In the next segment, we'll step back and look at the bigger picture. Because while each of these vitamins can cause harm on their own, it's the combinations, the routines, and the misunderstandings that often do the most damage. Now that we've explored the hidden risks of 5 common vitamins, it's time to return to what your body truly needs: real food, whole, natural, nourishing food that supports your brain, heart, and overall health, without the risks that can come from over-supplementing, because your body wasn't designed to rely on pills. It was designed to thrive on balanced nutrients from foods your system knows how to absorb and use properly, instead of chasing high-dose capsules. Think about simple meals that offer steady energy, hydration, and brain-friendly fats. A boiled egg offers protein. Your muscles recognize. Avocado delivers healthy fats that cushion and protect brain cells. Whole grain toast gives you slow, reliable fuel. Berries provide antioxidants that fight inflammation gently without overwhelming your system. A glass of water in the morning helps your brain function more clearly. These aren't extreme changes, they're quiet, powerful steps toward real wellness. The foods that support your memory and clarity also support your heart, mood, mobility, and immune system. Leafy greens, wild fish, nuts, seeds, whole grains. These aren't fads. They're foundational. And when eaten consistently, they don't just keep you full. They help you heal. At this stage in life, it's not about doing more, it's about doing what matters. Pills have their place, but understanding your body's real needs is the most important medicine. Slow down, listen to how you feel, and let food become your ally again. Your body will thank you, not with promises, but with steady strength and clearer days ahead. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching. And here's to living life on your own terms.